Hello, I'm Sana. I'm the Advice and Support Services Manager. I have my colleague Sejal, our Advice and Support Pharmacist, who will be answering any questions or responding to comments you may have in the chat. Do feel free to post these throughout the webinar today. The Advice and Support Team is the NPA's in-house team of experts. We are sometimes called the Advice Line. Our current team has experience in community pharmacy, working in both NHS and private sectors. Some are continuing their practice as they work with us, whether that is in a brick and mortar pharmacy or a distance selling or general practice. We are on speed dial for many of our members as the go-to for any query they have. It could be a quick question or a more complex query. We are here to help. Sometimes the situation that may arise in your pharmacy may not be as simple as it may look. Our team is trained to look into hidden queries. As healthcare professionals, we can have discussions with you and your staff to ensure you are empowered with knowledge to make the decision for the best interests of the patient or your business. So let's go through some real life queries and I can show you how we provide advice and support. So here we have a prescription from an EEA state. We would start off ensuring the prescription is legally valid within the UK. However, on a side note, we would ask a simple question. How is that medicine going to get to the patient? This may open up a whole discussion as there may be a case where the medicine needs to be posted abroad. It may be something the pharmacy team did not think of when they first called us. This second query is clinical. We have access to a range of subscription resources that can help provide in-depth information where available. Here, we would also ask the condition the herbal medicine is being used for. Usually, it is an existing condition they are already being treated by their GP. Could this be problematic? We would also discuss the need for the patient to inform their GP and the necessary record keeping the pharmacy needs to undertake. This last query is where our team is happy to have a conversation from beginning to end. We normally provide initial food for thought, for example, and the member can call us back as they research more into whether the service is suitable from a business standpoint. What is the point of starting a service if it will not yield positive outcomes? You can access a lot of our information online through our membership hub, which I will show you now. This is npa.co.uk, our public-facing website. If you click on Membership Hub on the top right-hand corner, it will take you to this page. If it's your first time, click to register. If you've forgotten your password, you can now reset it yourself by clicking on Forgot Password. Next is a video showing you how you can find our information on the hub and what is available at your fingertips. Welcome to the NPA Membership Hub. Hover over Members and click on Pharmacy Support. This is a hub brought to you by Pharmacy Advice and Support Team. It lists all the key topics where you can find our information digitally. I'll go through most of these with you in detail so you can get a flavour of what's available. Let's start with funding and reimbursement. As a pharmacy owner, you may find this very useful. We have a funding impact calculator tool which will help you calculate your business's profitability. As pharmacy staff, you have key information on fraud checking, drug tariff, OPD, as well as SSP. Let's go into medicine shortages. You have a link to accessing the free NHS medicine supply tool, as well as step-by-step guide on how to deal with medicine shortages within your pharmacy. Let's go back to the hub. Patient safety. You can download and read our MSO reports for England and Scotland from here, as well as access our resources on safeguarding and duty of candour. Pregnancy prevention program. We have information on all of these 3 drugs. Let's go into one of them. Here you can see NPA resources as well as links to external sites to ensure that your pharmacy teams know how to supply this particular drug safely and effectively. Back into patient safety, I just wanted to highlight the incident reporting tool. We have links to incident reporting for all 4 UK countries. Let's go into England. You have a guide on how to report via Report Smart, how to register, how to log in. And remember, you can report your incidents as well as your near misses. Back to our main hub, NHS services. We have the NHS services for all 4 UK countries. Again, let's look at Scotland first, and then I'll quickly go into England. We have resources for the adult and childhood flu vaccination services here, as well as other enhanced and advanced resource services. Back to the pharmacy support hub, private services. You will find links to our key private services that pharmacies support their patients with. And you will find our malaria prophylaxis leaflet from here, as well as links to particular trusted partners where you can find any equipment as well as PGDs to provide that particular service. Independent prescribing. Again, we have country-specific information, but I'm going to go and show you the list of all the resources available currently. They have all been looked at by our indemnity team, so you can be assured that they are providing the best information to you for your IPs to undertake this particular service. Not only do we have SOPs and other templates, we also have a medical history consultation checklist. We have a prescribing competency assessment and declaration, how to expand your scope of service, your scope of practice, apologies, as well as FAQs. We also have key prescribing principles, as well as information on particular prescribing aspects like weight management and propranolol. Back to the hub. I would advise you to have a look at the guidance on safe working in EDI, but let's go into control drugs. You will have here information on links to CD-specific SOPs, as well as other legislative and regulatory information that we provide on CDs. We also have information on CBD and LVANs. I'm going to go into the bank holiday supply guidance, just so that you can see another knowledge article where we cover appropriate dates, home office wording, as well as key points on how to deal with your prescriptions that come through on these particular times of the year. Back to the main hub. You can download our SOP templates either as a whole zip file or individually as per the topic that they fall under. Once you've downloaded them, you can amend them to your pharmacy's particular way of working. Clinical governance. We have information on all 4 UK countries, as well as a link to our whistleblowing resources. As digital technology advances, we have information that you would want to have a look at on data protection, pharmacy IT systems, and CRS in England, and AI. We have a knowledge article on automated clinical checking using AI technology, because we have been asked a lot of questions on this, and all of that is within here. Pharmacy regulation. As you can see, we do provide information on RPs and pharmacy technicians, as well as other healthcare professionals. We have general guidance on prescriptions, as well as emergency supply, vet prescriptions, EA and Swiss prescriptions, revalidation, and naloxone supply. 3 key topics here, and these are very big topics at the moment: supervision, hub and spoke, and advertising. Let's go into advertising. Our knowledge article on advertising outlines what you can advertise, not what you can't, as well as the differences between private and NHS. Going back to our hub. Online pharmacy. Providing services at distance, we have key resources for you, not just the remote consultation pack, but also a checklist as well as a risk assessment. Practice support. We provide key information for your teams on all of these different topics. I'm going to go into the red flag fact sheets so you can have a look at the number of self-care and red flag referral support sheets available. There are on a lot of over-the-counter queries that you may receive, so it's a good idea to download these, print them off, and share with your teams. They can keep them by their side when they're providing over-the-counter care or services. Last of all, pharmacy business. We do provide information on locums, VAT, business continuity, DBS, as well as all the other topics that you can see. Thank you. This basically shows, and I'm going to make sure that this video is working by the time it gets to yourselves, as I mentioned before, is how to use our hub. So please do feel free after this webinar to go onto our hub, register if you haven't already done so, and start having a look around and finding where our information is. So we are here to help support pharmacy teams as their practice evolves. We're trusted by thousands of community pharmacies, and we actually do deal with tens of thousands of queries every year. Thank you. I am now going to go into the chat to see if there's any questions that we've been asked. And I will also go through some of the questions that have come through to us previously, which will be quite useful. So if you haven't put any questions through, I'll give you a few moments to do that now. So one of the questions we've had asked previously is about how many IPs we have in our team. And as I've mentioned, we do in our particular team, the pharmacy advice and support, we have 2 independent prescribers, but we have several other independent prescribers across the NPA. There's another question that we've had come up a few times is that you've tried to click on forgot password, but you're still having trouble. What do I do? So if you have registered already on the membership hub and it's not working when you click on that little link, please do contact our colleagues in member services and they will be able to support you. Okay, I think that's it. So we have run out of questions. So thank you so much for joining. And I hope to catch you on the telephone, or if I've ever see you face to face, goodbye.